And welcome to another Mark Bishop show. This podcast, interesting really, from what I understand, each state has Medicaid and CHIP programs which provide health insurance for children up to age 19 in families with low and moderate incomes. Now, eligibility generally depends on how many people are in a household and family income. Eligibility varies by state. And in most states, children up to age 19 with family income up to $50,000 per year for a family of 4 may qualify for Medicaid and CHIP response. So, in recognition of May as Mental Health Awareness Month, CMS wants to remind parents that Medicaid and CHIP help support children by providing access to essential behavioral health services. So this includes mental health services both in person and virtually. And as the PHE continues and children grapple with ongoing changes in their lives, it's more important than ever to make sure children have access to and use behavioral health services offered through Medicaid and CHIP. So my very special guest is Dr. Aditi Mallick. And I want to ask you this, Doctor, what are Medicaid and CHIP? Who is eligible for these programs?
Yeah, I'm so glad you asked. Medicaid and CHIP, which stands for the Children's Health Insurance Program, offer free and low-cost health coverage for eligible children, teens, and adults. Families and individuals can apply online, by phone, by mail, in person, and enrollment is open year-round. Collectively, these programs insure almost 87 million people across the country, including 40 million children. In terms of who is eligible, each state has its own Medicaid and CHIP programs that provide health coverage, specifically for children up to age 19 in families with low and moderate incomes. The eligibility will depend on how many people are in the household and the family income, and it does vary state by state, but in most states, children up to age 19 with a family income up to $50,000 per year for a family of 4 may qualify for Medicaid and CHIP. If you are wondering, does this apply to me and my children and my family, please visit insurekidsnow.gov or call 1-877-KIDS-NOW. Again, that website is insurekidsnow.gov, and that phone number is 1-877-KIDS-NOW.
So, Doctor, why is it so important for children and teens to have access to behavioral health services, including mental health services?
That's a great question, Mark. I'm so glad you asked. It really is a crisis in this country. So prior to the pandemic, prior to the public health emergency of COVID-19, as many as 1 in 6 kids between the ages of 6 and 7 had a treatable mental health disorder. The most common being ADHD, anxiety, behavioral problems, and depression. And there are really unique vulnerabilities and developmental implications when it comes to mental health in children. It impacts the way they learn, the way they relate to others, the way they behave. And if those conditions are untreated, can really impact an individual over the course of their life. And now you layer on top of that the additional stresses of the pandemic, changes in routine, virtual learning, isolation, not to mention some of the economic and other social stressors of grief and loss, food insecurity, economic stress that many families experienced. And we have seen a 30% increase in anxiety and depression in young people since the start of the pandemic. And unfortunately, despite that surge, the use of mental health services has actually declined among children and teens ages 18 and under. And so really want to get the word out about the availability of healthcare coverage as a gateway for people to be able to access much needed mental health services and substance use disorder services that we comprehensively think of as behavioral health.
Can you tell me this then, Doctor? Are there any disparities in how different populations access mental health services?
Unfortunately, there are. Many minority populations are less likely to even seek out these services. And when they do, can often face difficulties in accessing care because of language or culture or financial or insurance-related issues. And that really has been compounded, unfortunately, by the pandemic. Over the last 2 years, as I said, kids are facing really unique stresses around virtual learning, a lack of broadband, perhaps loss of a family member or a caregiver. I mean, we've lost 1 million people in this country, and many of those million people were connected to children. And so you layer that further on top of recent spikes in violence and discrimination, like what happened in Buffalo this past weekend. And that's really disproportionately impacted the mental health of many minority children and teens.
So if a child or teen has missed a doctor's appointment over the last year, then what should parents do?
The first thing I'll say is it's not too late. So it's really important for children to get back on track with their medical and dental care. In the case of mental health, the majority of mental health disorders arise early in life, in childhood and adolescence and early adulthood, and can interfere with a child's learning, behavior, emotional resilience, et cetera. And so it's not too late. Due to COVID, many routine well child visits had to be postponed. And that kept kids and teens from getting really important preventative services like vaccinations and hearing and vision screenings. And even though we saw those services decline really sharply during the pandemic, and some of them have rebounded, but there's still really millions of services that need to be delivered to make up for that lost time. And when we look across all the health services examined during the pandemic, mental health services have seen the smallest improvement, and they're really not rebounding at the same rate as other health services. So what I would underscore is well child visits, vaccinations, routine childhood screenings, dentist visits, any of those, in particular well child visits, are a really good time to talk to your child or your teen's healthcare provider about any mental health care concerns that your child or teen might be experiencing too. And I want folks to know, like I said, it's not too late. And Medicaid and CHIP cover all of those healthcare needs. These programs collectively for people under the age of 19 in families whose incomes are generally below $50,000, that comprehensive coverage includes behavioral health, like mental health services, plus all of the routine well child visits and screenings that I mentioned.
How can families with eligible children and teens enroll in coverage?
I'm so glad you asked. So I'm going to repeat again the website and the phone number, where think of those as really your one-stop shop for additional information about these programs. That website is insurekidsnow.gov. That's INSUREKIDSNOW.gov. And the phone number, again, is 1-877 Kids Now. That's KIDSNOW. And there's a link on that page about finding coverage for your family. It specifically says find coverage for your family, and it'll take you directly to enrollment information. You can apply online, over the phone, by mail, or in person. There is no specific enrollment period, so you can do it today, you can do it tomorrow, you can do it 2 weeks from now. The process to apply for this free or low-cost health coverage for your child or your teen has gotten a lot faster. Many people actually can apply and find out if they qualify that same day. And if you're already enrolled, I want to take the opportunity to put in a plug to make sure that you confirm the address that you have on file with your state Medicaid or CHIP agency, because they do sometimes send out very important notices like annual renewal reminders that'll come through paper mail.
That's fabulous. Dr. Aditi Mallick, before we go, please share with me the website again and phone number, and let's get this out and make it very clear. It'll also be on, of course, up on the bio and up on the publishing.
Sure thing. Yeah, I'm going to give you the website and the phone number one more time. The website is insurekidsnow.gov, and the phone number is 1-877-KIDS-NOW.
So thank you for that.
Have a great day, Mark.